welcome to MBBS Dose. Today we are going to learn about some basic terminologies of medical which are frequently being used without their description, because these are the terminologies, and when anyone is saying the words, you are supposed to understand them. Okay, so we will learn the words as well as what do they mean with the help of some diagrams as well, because generally when we used to see diagrams, it gets more clear in our mind. Okay, so our first word of the day is benign. So basically all the type of tumors which are not cancerous are termed as benign. Okay, but the opposite to benign is malignant. Malignant are the type of tumor which are cancerous. They can spread in your body from one place to another. So in the body they are like spreading. Okay, but benign is something which is confined to a particular place. So these two words are needed to be learned together to make it easy to understand. Okay, then we have biopsy. Biopsy is a very common term you must have heard in the hospitals whenever there is a surgical incision done or excision done and we have an abnormal mass inside our body. Then the mass is sent for the test biopsy. It is basically a tissue sample which is being used for the testing purposes. We just need to get that particular tissue from any particular site which is suspected, and generally we do biopsy for malignancy detection. Okay, either it is malignant or not, whether it is malignant or not, we just do this by doing biopsy. This is the most common use. Okay, now we have two different terms, which is hypertension as well as hypertension. These two terms are especially being said for the blood pressure. When the blood pressure is low, we will call it as a hypotension. I just give you a trick. Low has O and hypo also has O. So you just simply remember that hypo means low blood pressure. Okay, again we have hypertension. Hyper means something high, so it is like high blood pressure. We have a term which is lesion. Lesion is something which is any type of wound or sore or any type of cut. Okay, but before heading forward, let's learn about benign and malignant tumor with the help of a diagram. So you can see here, benign tumor is something which is confined by a boundary, and it is it is situated in a particular place. It is not moving here and there. But in case of malignant tumor, you can see that the part of the tissue are spreading out of the body. You can simply see that they are just evading out from the tissue and they are going to go and metastasize. It means that they're going to go and spread in the body. Similarly, we have biopsy. You can see here, here's a lung, and we are having a diagram in which it is shown that there is a tumor in the lung, and this tumor, the tissue from this tumor is supposed to be taken out for the biopsy testing. For that, we will be using biopsy needle. You can see how it is penetrated all the way through the skin. This is the layer of skin, how the needle is penetrated all the way through skin, and this tumor is being extracted, or you can say a part of this tumor is being extracted for the purpose of biopsy. Okay, now we have a term non-invasive. So in medical, all the procedures, you can say, which do not require entering the body. So whenever there is no requirement of entering the body with instruments, though all those processes are known as the non-invasive. On the other hand, when we use any kind of instruments to invade into the body, to go through the skin or something like here we are doing biopsy, it is a process which is invasive in nature. So it will be invasive. Okay. Now we have two terms, outpatient and inpatient. You must have heard in the hospitals OPD word. That OPD means outpatient ward. Okay, outpatient department, sorry. So basically outpatient are the patients who check in and out on the same day. It's like you went to a doctor to have some common problem, to check about some common problem, and then the doctor suggests you some medicine and you take the medicine and then go back home. You will be an outpatient. Now if a person is having certain abnormalities or anomalies which is not easily treatable, so the doctor asks him to stay at the hospital at least for a night or even more than that, depends on the situation. Then once the patient is admitted into the hospital, he or she will be called as a inpatient. Okay, perfect. Now we have acute. Word acute means sudden, which is something which arises suddenly in the body, and it is usually for a short period of time. Okay, so acute illness is very common. Okay, now we have chronic. So these two, acute and chronic, again are the opposite. Those who happen to be sudden and stay short are called as acute, but those who are long term, okay, those diseases or those illness which are being prevailing in the body since long are termed as the chronic. So chronic illness. Now we have another term which is called as edema. Simply edema means swelling. You can see two legs here together. in which this one is normal and this one is edematous leg. So edema can be seen easily. You can see how the inflammation has occurred and how the swelling is being there. Okay, so this is the explanation of you can say a medical term for swelling is edema. Now we have embolism. This word is very common when you learn about heart and cardiology. So any kind of blood clot is called as embolism. Now we have suture. Suture is medical term which is definitely used for the word stitching. So stitching is a process in which we used to do the you can see this diagram and you can infer from this. Any cut is made, any surgical process is being done, then we have to put the skin together and do the suture through that, do the stitching through that. So basically the common word is stitching, but in medical terms we use stitching, we use the word suture. Okay, perfect. Now we will learn about two types of fractures, which are the basic medical terms, and these type of fractures are very common to happen. One of them is compound and the other one is comminuted. So compound fracture are those in which broken bone that protrudes through the skin. So protrusion of through the skin, you can say here is a diagram of fracture which is compound fracture. So compound fracture, you can see here the bone is broken and it protrudes out of the skin. In the x-ray as well you can see the skin is broken. Okay, so broken skin and the broken bone is protruding out of the broken skin, then it is called as the compound fracture. For the comminuted fracture, we have bone that shatters into many pieces. In this diagram you can see how comminuted fractures can be depicted here. You can see this part of bone is completely broken and you can see how small particles are there. It means that bone has been broken into many particles. It means that it has been shattered all through. Okay, perfect. So this was it, the basic terminologies of medical you need to remember for in the beginning itself. Okay, after that I'll be doing another series of the same video with some other most commonly used medical terminologies. Thank you for watching there. If you really like the video, do hit the thumbs up and give it a subscribe also. Do share my channel, and yes, all the best. Thank you so much.